do. So when we have our community sessions, we usually invite the CHPs, and they usually come with their booklet, which is the referral booklet. And when we talk to young people and identify one that might have a problem, it can be counseling, it can be so many other things. Maybe they need child assistance, they need someone to talk to, and we're not in a position to talk to them. We'll refer to them, we'll write them a referral book and send them to a referral clinic, which is nearby the area that we are.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll.
Thank you very much, and welcome to another episode of the African NCD Champions podcast, where we meet and talk with young people working in the non-communicable diseases space across Africa, creating change and impact in the continent. In this mini-series, we are featuring young people from the Young Health Program, a program implemented by Plan International in Kenya, and with support from AstraZeneca, looking forward to increasing literacy, access to diagnostics, and policy change on non-communicable diseases and sexual and reproductive health. In Kenya, the program has been implemented for over 10 years in Kibera and Mathare, which form some of the biggest informal settlements in the country and in the continent. Today, we are joined by one peer educator who has been working in the community, and we'll be looking forward to learning from her experiences and what she has been doing to ensure that young people continue to access services in the non-communicable disease space. Without further ado, give us a quick, maybe not so quick, but give us an introduction to yourself, what you do, and how you got to be here today.
Okay, I'm Jackie Okoyo. I'm a peer educator with YHP in Kibera. What I do as a peer educator is inform, engage, and educate young people on non-communicable diseases and their risk factors within my community. These young people are people between the ages of 10 to 24 years. That is our main focus, but we also inform and educate people of other ages, but our main focus is people of 10 to 24 years. Yeah.
Great. So as a peer educator working in Kibera, what are some of the activities that you actually do with these young people in the Kibera area?
Okay. Some of the activities that we do is we do mobilization, where we bring people together and talk about issues that affect them directly. We also talk about non-communicable diseases, which there's a way we put them. It's called a 5x5 module. 5 risky factors and 5 non-communicable diseases. We did that because we understand that it's easier for young people to understand 5x5 module, because you have 5 fingers on this hand and 5 fingers on the other hand. So if you look at your fingers, there are 5. These are 5 risky factors. And if you look at the other side, there are also 5. These are also 5 non-communicable diseases. So these 5 risky factors, one of them is tobacco use, use of alcohol, unhealthy diet, physical inactivity, and air pollution. And these risky factors and these non-communicable diseases are cancers, diabetes, hypertension, mental illness, and things like asthma. So when you look at your finger, it will be easier for you to remember the non-communicable diseases and the risky factors rather than putting it in any other way. Yeah.
Interesting. So how many schools have you worked with, and what area do you cover?
Okay, in Kibera, we work with 5 villages. In each village, we have 3 peer educators. And each peer educator has a school that they usually visit on weekly basis. So we work with 12 schools within the community.
Yeah, so we see a lot of young people, especially between the ages of 10 to 24. These are very young people, and with this age group, there's a lot of learning that is happening. We also know that some of the activities in the program include things like diagnostics and referrals as well. So talk to us a little bit more about your work in as far as diagnosing people and referring them, and how you work with the community health promoters.
Okay, let me just talk about community health promoters firstly. Community health promoters are very vital key stakeholders in the communities when it comes to matters health, because they engage more with the community, even more than us, the peer educators, because they get to visit households every month. Each community health promoter within the community has 100 households, which they visit on a monthly basis. So when we engage with them, they can easily get our target group ages and bring them on board to what we are educating the communities. So us engaging the community health promoters has been really helpful and impactful to us as the peer educators, because we get to reach our target groups, which is 10 to 24 years. The peer educators will go to the household, talk to the parents of these young people, and they'll be able to bring them to our community sessions.
Yeah, so and that's a very smart way of working, because the community health workers will always visit 100 households, and if they identify these young people, they refer them back to the program. But also, have you seen scenarios where you work with community health workers to refer the young people to different health services?
Yeah, we've worked with them to refer young people to different health services by doing community outreaches and the community sessions that we do. So when we have our community sessions, we usually invite the CHPs, and they usually come with their booklet, which is the referral booklet. And when we talk to young people and identify one that might have a problem, it can be counseling, it can be so many other things. Maybe they need SRHR assistance, they need someone to talk to, and we are not in a position to talk to them. We'll refer to them, we'll write them a referral book and send them to a referral clinic, which is nearby the area that we are. Yeah, and we also do community outreaches. We go with the CHPs, they have a machine, they have a hypertension machine, and they also have diabetes screening tool. So when we engage them during community sessions, they usually come with their machines and they're screening their diabetes screening tools, screen the people that we talk to. We give information while they screen them. So when they screen them and maybe we find that someone has a problem, maybe your blood pressure is high, we'll write you a note on the referral books and then send it to a facility nearby.
Now, what are some of the biggest or most memorable experiences that you've had as a peer educator working with the community health promoters, that you can say that in my 5 years of working in the project, these are some of the key highlights that I've seen in my work?
Okay, I've seen a lot of great things happening since I started working. It's my 5th year right now, and I've seen a lot of great things happening within the community. Like those people that did not like visiting the facility, right now, because of what the information that we've given them, what we've taught them, they're now able to go to the facilities and ask for assistance that they need without us forcing them to do it. Before I started working with these people, they were very reluctant on going to the facilities. Like, we understand young people don't like going to these facilities, but since I started talking to them, right now they can even ask you, is whatever I need, like most of the time they ask me about contraceptives and condoms. So they'll ask me, is whatever I need in that facility, should I go and pick it up? Then I'll just tell them, yeah, it's available, or no, it's not available at the moment, come back later, and they'll go without me forcing them to go.
Yeah, so in a way, you've really worked also to improve the health-seeking behavior of young people, because as you know, many young people don't like to go to the facilities, because the facilities are not youth-friendly. The facilities are not, most of the time, they do not really respect the young people's activities. So I guess the other question is also around, and this is my second to last question, is what other impact have you seen as someone who works in the community, works with very young people between ages of 10 to 24, and sometimes also in the community? What can you say are some of the big impact stories that you've seen that the work has directly had in the community?
Okay, I've seen a great impact in this time that there were a group of youths who used to smoke around without care of whoever is seeing them or whoever is not seeing them. But right now, when you go to that area, it's a base. We call it an area. When you go to that base, those people, when they see you as someone who has educated them, someone who has given them information, they will not do it anymore. So I think that's a great impact, because imagine if you just stay there the whole day, they will not use whatever they were using.
Yeah, so at least you're helping to change their behavior on smoking. Would you say, especially because you also work with the schools, that and we know that the program also works on the diet and nutritional side of things in the school, what could you say are some of the impact that has happened around that side in the school that you work with?
Okay, in the schools that we work with, I think young people, like the younger people, we work with 10 to 24, but those within 10 to 15 years are really fast in understanding and changing their behaviors. Like those people that we work with in the school, they 10 to 15 years, right now, most of them, let me not say all of them, most of them do not add salt to their food, which they used to do. Most of them now are engaging in activities like running, jogging, playing sports and all that. So I think that's a great impact, because it will change their lifestyle and how they get to live their lives.
I see. So final question, what are some of your key takeaways or some of your key messages to whoever who is watching and wants to be a peer educator, wants to be involved in the program? And what would also be your other key messages in terms of bringing collaborative working, where we have the peer educators working with the community health promoters to improve the health of the community?
Okay. What I'll say is, change starts with you. Change begins with you. Just set your mindset that you want to change. If you set your mindset that you want to change, I believe you can change. And whatever you're engaging yourself in right now, it will not help you in the future. So just decide that I want to change by focusing on what I want. If you're now eating unhealthily, please change to eating healthily. If you're not doing irregular exercises, please do regular exercises. Yeah. And how we can engage the CHPs is just by working with them closely, because CHPs are really key stakeholders in the communities on matters health. They know what affects these people because they come from the same communities. So if we engage them, they can really bring in new ideas on what is needed to improve the program and make it go forward.
Yeah, cool. So again, thank you very much for coming through and for sharing with us some of your key learnings working in the community. We have a part 2 where we'll be going into more details around some of your experiences in the community. But with that, thank you very much everyone for watching, and we'll see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storelink and at NCD Champions. See you on the next one.